Ladies, before your next blood test, stop right there. Because the truth is, there are at least 10 common mistakes that can ruin your results, delay your diagnosis, and even send your doctor chasing down the wrong problem entirely. And I can't tell you how many times I've seen this happen. Smart, capable women just like you, walk into the clinic, do everything they think is right, and then end up sitting in my office, scared out of their minds, all because of a mistake that was completely avoidable. That's why I made this video. I'm Dr. Ella, and today, I'm going to walk you step by step through the most common mistakes women over 60 make before getting their blood drawn. Some of these are simple, some are sneaky, and number 9, well, let me just say, even some nurses don't know about it. So if you've ever had a confusing blood test result, or if you've ever been told something scary that later turned out to be nothing, then please stick with me. And before we jump in, don't forget to like this video. Leave me a comment if you've ever had a blood test mix-up, and subscribe to Smart Senior for more practical advice you can actually use. All right, let's dive in. Mistake number 1, forgetting to fast or fasting too long. This one might sound obvious, but it's actually one of the biggest reasons results come back wrong. Here's the deal. Certain blood tests, especially ones that look at your blood sugar, triglycerides, or cholesterol, require you to fast for an accurate reading. And by fast, I mean no food, no drinks, other than plain water, for 8 to 12 hours before your test. Now that sounds simple enough, right? But here's where women often trip up. Some forget entirely. They grab a quick piece of toast, sip on their morning coffee with a splash of milk, and think, well, it's just a little. But that little bite or sip can send your numbers soaring. Your doctor looks at the results, and suddenly, it looks like you've got high blood sugar or sky-high triglycerides. And next thing you know, you're being told you might have diabetes, or you're being pushed toward cholesterol medication you don't actually need. But on the flip side, some women overdo it. They think, if 12 hours is good, then 14 or 16 must be even better. Wrong. Fasting too long stresses your body. It raises your cortisol, the stress hormone, and can even lower your blood pressure, leaving you shaky, lightheaded, and at risk of fainting during the blood draw. And worse, it can throw off kidney function numbers and electrolyte levels, making you look sicker than you are. The solution? Know exactly which tests you're having. Confirm with your GP if fasting is required. And if it is, stick to that sweet spot. 8 to 12 hours. Not less, not more. And here's a little bonus tip that most people miss. Black coffee or tea? Technically a number, especially if you're fasting for glucose or lipid panels. If it's water, drink it. If it's anything else, skip it. Mistake number 2, taking medications or supplements that interfere now. This one is sneaky. And let me just say, it's not your fault. Here's why. Most doctors don't bother warning patients, and most patients don't even think to ask. But the truth is, some of the most common medications and supplements can seriously mess with your blood test results. Let me give you an example. Biotin. It's in nearly every hair, skin, and nail supplement out there. Totally harmless, right? Wrong. Biotin interferes with thyroid hormone tests, sometimes making it look like you have hypothyroidism, or worse, that your thyroid medication isn't working. I've seen women get prescribed higher doses of thyroid meds when their thyroid was perfectly fine. Then there's ibuprofen, something so many seniors take for aches and pains. But ibuprofen can alter kidney function markers. Steroids? They bump up your blood sugar and white blood cell counts. Water pills, also called diuretics, mess with your electrolytes like sodium and potassium. And even good old vitamin D, if taken right before your test, can make your calcium look artificially high. And here's the kicker. Most women don't even consider vitamins to be real medication. But your body doesn't know the difference. Everything you swallow changes your internal chemistry. So what's the fix? Simple. Before your test, tell your doctor everything you're taking. Prescription medications, over-the-counter pain relievers, herbal remedies, vitamins, powders, teas, oils, even essential oils you consume. Nothing is too small to mention. Sometimes, your doctor may ask you to pause certain supplements for 24 to 72 hours before your test. But don't just guess. Always ask first. Mistake number 3, not drinking enough water. Now picture this. You wake up, you skip breakfast, you skip your coffee because you're fasting, and you head to the clinic. You sit down, the nurse ties the band around your arm, and she can't find a vein. She tries the other arm. She warms your skin. She pats the back of your hand. Nothing. Sound familiar? That's dehydration at work. Older women are especially prone to this because as we age, our body's natural thirst signals fade. You may not feel thirsty, but your blood volume and your skin elasticity are lower, and your veins are harder to find. And here's the bigger problem. Dehydration makes your blood more concentrated. That means your hemoglobin, hematocrit, and even electrolyte levels can look falsely high. Your kidney function might look impaired when it's not. The fix? Drink water. Unless your doctor specifically told you otherwise, which is rare. Have 1 to 2 glasses of plain water an hour before your test. Not juice, not coffee, not tea. Just water, enough to rehydrate your body and plump up your veins, but not so much that you're running to the bathroom every 5 minutes. Mistake number 4, exercising strenuously the day before now. I love when my senior patients stay active. Exercise is medicine. It keeps you mobile, strong, and independent. But when it comes to blood tests, timing matters. If you hit the gym for a heavy workout, do a long hike, or push yourself hard with weights the day before your blood draw, you're setting yourself up for confusing results. Here's why. Exercise, especially resistance training, creates tiny tears in your muscles. That's normal. That's how muscles rebuild and grow stronger. But it also bumps up certain blood markers, creatine kinase, liver enzymes like ALT, even lactate dehydrogenase. These can all rise after exercise. So let's say you're being tested for liver disease, heart issues, or muscle inflammation. Those elevated markers might raise a big red flag that's not actually real. And if you're someone already prone to being misdiagnosed with fibromyalgia, inflammation, or vague muscle pain, this can lead to unnecessary worry, medications, or follow-ups you don't even need. So what's safe before a test? Gentle walking, light stretching, some yoga. Keep it low intensity. But skip the strenuous workouts for at least 24 to 48 hours before your blood draw, especially if your doctor is looking at liver, muscle, or inflammation markers. Mistake number 5, showing up anxious or flustered. Now, this one might surprise you. Your emotional state, the way you feel when you walk into that clinic, absolutely affects your results. When you arrive rushed, stressed, or flustered, maybe from traffic, maybe because you're nervous about needles, your body goes into mini fight or flight mode. Adrenaline and cortisol spike. That alone can bump up your blood sugar, raise your blood pressure, shift your white blood cell counts, and even temporarily affect thyroid and heart rate readings. I once had a patient who came in late, stressed and panicking. Her cortisol and blood sugar levels looked through the roof. A week later, She redid the same test after sitting calmly in the waiting room. Perfectly normal. So what can you do? Arrive early? Give yourself at least 10 to 15 minutes to sit quietly. Breathe deeply. Don't doom scroll scary health news on your phone. Just let your body reset. Think of it like stepping on a scale. You want your baseline, not your stress weight. Mistake number 6, not asking which tests require special prep. This one's a biggie, and it trips up more people than you'd think. A lot of women assume all blood tests are the same. You roll up your sleeve, they take some vials, and then you wait for results. Simple, right? Not quite. The truth is, different tests have different rules. Some require fasting, some don't. Some have to be drawn in the morning. Others can't be taken right after you've had certain vitamins or medications. If you don't know the rules, you can end up with results that don't reflect your real health. Let me give you some examples. Fasting blood sugar and lipids. These require fasting. And if you don't, your results can look much worse than they are. Thyroid tests. You don't need to fast, but time of day matters. They're best drawn early in the morning when your thyroid hormones are naturally most stable. Iron studies. These are also better in the morning, and ideally, not right after you've taken your iron supplement. Otherwise, your iron levels can look artificially high. Cortisol or ACTH. These absolutely have to be drawn between 7 and 9 a.m. because cortisol follows your body's natural daily rhythm. Draw it at 2 p.m. and you'll get a totally different picture. Parathyroid hormone and calcium. These shouldn't be checked right after you've taken vitamin D or calcium. The timing can make your levels look off. The mistake women make here is trusting that the lab or the doctor automatically sets everything up correctly. But here's the truth. Sometimes instructions aren't written clearly on the lab form. Sometimes no one tells you. And sometimes you're left fasting when you didn't need to, or not fasting when you actually should have. The fix? Before your appointment, call your GP's office or the lab. Ask directly, do these tests require fasting or special preparation? It only takes a minute, and it saves you days of stress and potentially misleading results. Think of it like baking. If you don't know the recipe, you can't expect the cake to come out right. Your blood tests are no different. Follow the right recipe, and you'll get the real answer about your health. Mistake number 7, drinking alcohol the night before now. Let's talk about this one. I'm not here to judge. Many women enjoy a glass of wine with dinner, and for some, it's a nightly ritual. But if you've got a blood test in the morning, that glass of wine, or any alcohol at all, can mess things up more than you realize. Here's why. Even a small amount of alcohol can raise your triglyceride levels, temporarily elevate your liver enzymes like ALT and AST, dehydrate you, which can make your blood harder to draw and your results less accurate. Lower your blood sugar, especially if you're on diabetes medications. Interfere with how your medications are metabolized. Let's say you're having a liver function test. If you had 2 glasses of wine the night before, your liver enzymes might come back flagged as abnormal. Your doctor sees those numbers and thinks, uh-oh, possible liver disease. Suddenly you're getting sent for repeat tests, ultrasounds, and possibly seeing a specialist, all because of 1 glass of Merlot. Or maybe you're being screened for metabolic syndrome. That evening cocktail could spike your triglycerides or blood sugar just enough to tip you into the abnormal category. Now you're being told you're pre-diabetic when, in reality, your numbers might have been perfectly fine without the alcohol. My recommendation? Avoid alcohol for at least 24 hours before your blood test. If you really want to be on the safe side, give it 48 hours. I know it might feel like a small sacrifice, But think of it this way. Would you rather skip one drink or deal with weeks of worry and follow-up tests over a false result? Your health deserves accuracy. Don't let a single glass of wine cloud the truth. Mistake number 8. Wearing tight sleeves or difficult clothing. Now this one might sound almost silly. After all, what does your outfit have to do with your blood test? But trust me, after years of working in clinics, I can tell you it makes a big difference. Here's what I've seen. Women walking in with long-sleeved blouses with button cuffs, layered sweaters, or even turtlenecks that barely roll up. When it's time for the draw, they struggle to get their sleeve up. Sometimes they have to fully undress from the waist up in that little clinic chair, which is stressful, uncomfortable, and slows the whole process down. I've even seen sleeves rolled up so tight, they cut off circulation, making the draw harder and more painful. And if your phlebotomist can't easily access that sweet spot inside your elbow, the antecubital fossa, they may have to go for smaller, more painful veins in your hand or wrist. Not only does that hurt more, it also increases the chances of bruising. So what should you wear? Choose a loose, short-sleeved shirt. Or, if it's cold, wear a cardigan or sweater that easily opens in the front so you can slip it off one arm. You want quick, easy access to both arms without wrestling with fabric. Think of it like this. You wouldn't wear lace-up boots to the airport security line, right? You'd pick slip-ons. Same with blood tests. Make it easy for yourself and the nurse. Here's a quick doctor tip. If you know your veins are small or tricky, mention it up front and wear clothing that gives the phlebotomist as much freedom as possible. A cooperative outfit equals fewer pokes, less stress, and a smoother experience overall. Mistake number 9. Not mentioning menopause or hormone therapy. Now, this is one of those mistakes that surprises almost everyone, patients, doctors, even nurses. But it's a big deal, and it can completely change the way your blood work is interpreted. Here's the truth. Your hormonal status matters. Whether you're postmenopausal on hormone replacement therapy, HRT, or using creams, patches, or pills with estrogen or progesterone. This information changes the meaning of your results. Let's say you're on estrogen therapy. Estrogen affects cholesterol by raising your HDL, the good cholesterol, and lowering your LDL. That might sound wonderful, but if your doctor doesn't know you're on HRT, they might think your cholesterol numbers are naturally that good, or that your medication is working better than it really is. Another example, FSH and LH levels. These are hormones that reflect menopause status. If you're postmenopausal but still using hormone therapy, your numbers might look confusing unless your doctor knows the full picture. Even thyroid tests can be subtly affected by estrogen, because estrogen changes how thyroid-binding proteins behave. I had one patient who was referred to an endocrinologist for abnormal estrogen levels. After weeks of worry and an expensive specialist visit, we discovered the truth. She was still wearing her estrogen patch. The lab simply hadn't noted it. So here's the rule. Always tell your doctor and the lab if you're menopausal, if you've gone through menopause, if you're using HRT, or if you've recently stopped. Be specific. Creams, pills, patches, gels, whatever form it takes, it matters. Your blood work doesn't exist in a vacuum. Context is everything. Give your doctor the whole story so your results actually make sense. Mistake number 10. Leaving right after the draw without checking now. You've made it through the test. The vials are filled, the tape is on your arm, and you're ready to grab your bag and head out the door. But here's where so many errors happen, and most women don't even realize it. Too many patients leave without confirming a few critical details. And trust me, skipping this step can cost you time, money, and in some cases, your safety. Here's what you should always check before leaving. Were all the correct tests drawn? Sometimes, one of the vials on your doctor's request form gets missed. Maybe the lab tech didn't see it. Maybe it was a miscommunication. If that happens, you'll get a call days later saying you need to come back. Did they collect enough blood? Some tests require a minimum amount of sample. If they don't fill the vial enough, the lab may reject it. And again, you'll have to repeat the test. Was it labeled properly? It's rare, but it happens. A mislabeled vial can send your results to the wrong chart, which can cause frightening and dangerous mix-ups. Do you know when and how you'll get your results? Will your doctor call you? Should you log into a portal? Do you need to book a follow-up? Never leave without clarity. And finally, a safety point. If you're prone to dizziness, fainting, or you've been fasting, don't just hop up and walk out. Sit for a few minutes. Drink some water. Let the staff know if you feel lightheaded. I once had an older woman leave too quickly after her draw. She stood up fast, felt faint, stumbled in the parking lot, and ended up in the ER, not because of the blood test itself, but because she hadn't taken a moment to recover. The takeaway? Slow down, double-check, ask questions. A few extra minutes at the lab can save you days of stress. Ladies, your health is too important to let simple mistakes get in the way. Blood tests are one of the most powerful tools we have to catch problems early, but only if they're done right. So the next time you're headed for a blood draw, remember these 10 mistakes and avoid them. That way, you and your doctor will be working with real, accurate information, not false alarms. If you found this helpful, give this video a thumbs up and don't forget to subscribe to Smart Senior for more practical advice to help you live healthier, longer, and with more confidence. And now I want to hear from you. Have you ever had a blood test come back abnormal